First News with Keeler in the morning on WIBX and WIBX950.com.
Dr. Dennis Branson is from Fayetteville, and Monaski just recently went out there for XO hair. Do you want to talk about this just briefly before we bring it in?
So this was an injection. I say it's not an invasive surgery. It's not a surgery of any kind. It's just an injection under the scalp. The doctor goes to several areas, obviously in the areas that you need it. And it
didn't hurt?
I mean, you're getting a shot in the head. There's a pinch, you know.
Okay.
I've never gotten a tattoo before. I wonder what it would compare to that. But, I mean, it wasn't painful. There was a little bit of anesthesia, just kind of on a cloth that he put on, and that helped numb it a little bit. But really, it wasn't anything that bad. And I say, when we were going into the break, we said, I'm getting this treatment. It was a one and done.
One time.
It's not like over time I need to go. I am due to check back with him in a couple of weeks just to measure and photograph the growth and see how it's going. But
painful for me is looking in the mirror.
Well,
because I'm like, where has all my hair gone?
This is one of those things, though. It's funny. I'm curious to know if you would consider doing this, or if you're at a point where you're like, this is. I've had a bald head for how many years? I'm used to it now. It's me. Because I've seen pictures of you with hair, and to me, I'm like, wow, you don't look like the same guy. Like, this is the Bill I know here, you know?
And
you have a good head. You could pull it off. You know, it's not like...
I feel my head, I have a very ugly head. That's what it is what it is, right? I've gotten used to it, and I live with it. I hate it.
It's congruently shaped, right? So there's no odd bumps or juts or
I don't think I do.
lumps.
Yeah,
it's nice and round.
I'm not a cone head. I don't think.
Right.
No, not at all. The doc has and showed me a picture. This was Roger asked the doc if he could grow hair on Bill's head. And the interesting
Thanks,
thing
Roger, for caring. Although I'm not sure that that's what you're doing right now.
Jesus turned water into wine.
Actually, Roger's one of the guys who says that he and his wife are monitoring me daily now. And
to see.
Yeah, he said if it works,
so
my wife's driving me out to Fayetteville.
Roger's question may be sincere. Let's bring the doctor on. Dr. Dennis Branson, good morning.
Good morning. How are you?
Good. So the sincerity of Roger's question is, I'm someone who has, and I make it I'm intensely telling people, I don't care what you see, I am not bald. I'm almost. So I still have hair up there. I still have to comb, and it doesn't seem to be falling out, but it is, if you get any distance away, I look completely bald. And so
it's very thin.
Can you, very, very thin, like to the point where I might as well be bald. So, can you grow hair on someone like me?
Yes.
Really?
No, I can't tell you that it's going to go from looking bald at 10 paces to looking like
Gene Shalit.
You're ready to be the lead in the
Nobody knows
rock
who he
star
is.
hair.
Right.
But it can increase it enough that you may be comfortable, saying I've got a little something back. Dial it back 5 or 10 years.
Okay.
Doc, there's a stat you mentioned to me. On I don't know if it was one particular doctor or a study done on this, but something like better than 95% of approximately 800 people in a survey or in this study saw hair regrowth.
One doctor had done about 800 patients with this. He specializes in hair replacement, and he said he was seeing results comparable to hair transplant. And the other people doing PRP were about half the people respond. He said over 95% of people did respond. Now the level of response, this is a biologic treatment, and so it's looking to help, nature sort of dial the clock back. But I can't tell you this is how far you're going to go. But people, even with bald heads that haven't had hair for a while, have seen hair come back.
Yeah, he showed me a picture of a guy who was completely bald head, and he had after I think 8 weeks, he had a strip down the middle, almost like a mohawk. It didn't, as he said, he didn't look like he was 18 or something. But there was, it was a significant growth change based on where he was. Let me ask you this as well. Do you know? I mentioned I've used the drops, I've used oils, I've used shampoo, the minoxidil, I've done the hair, skin, and nails pill. Do you know comparatively what the success rate is with those type of things compared to the better than 95% that you mentioned?
Well, the other treatments are not so much in stimulating hair growth; it's looking to slow hair loss.
Okay.
And in terms of like the minoxidil. that is more. My experience with that has been more that it made the hair you had a little bit thicker, and not so much bringing back increasing numbers of hairs.
Okay. So this is designed to increase the number and the thickness of the hair.
So, well, in terms of design, this is not. Understand one thing. This is not an FDA approved treatment yet. This is still going through clinical trials for FDA approval. This is a thing we've seen by experience, sort of, saying, "Gee, this can work? Does it work?" And then you formulate the trials to go for the FDA approval. So it's authorized for doctors to use. But understand, we're very impressed by the results we're seeing, but there's still things we're figuring out and how well this works, and what the limits are.
Well, we're in a society where getting a shot without FDA approval is really in vogue right now.
Well, right? It's a matter of understanding, the idea, the nature of the vaccines. It's not that it's unsafe. It's not that but in terms of a company saying, this is advertised for specific treatment. Those studies are going on right now.
Got it. Okay.
This is sort of the part that proves that we know that it's working, and now you're looking to formalize that in a way that the FDA can now say, yes, we agree that it works, and it's approved for that reason.
Okay. All right.
Dr. Branson, speaking of causes of baldness, and I sometimes suggest this to Jeff, before he would go and do the treatment with you, he'd wear a hat a lot. And a lot of people say all the time of wearing a hat over and over again or for long periods of time could accelerate hair loss. Is that a cause or a contributing factor?
Not really. I mean, the only way that the hair can contribute to hair loss is more by mechanical trauma. So if you have a size 8 head wearing a size 6 hat and you're squishing it down, you may just be rubbing some of the hair, but the hat's not going to accelerate your hair loss.
Yeah. And I always say it's like a chicken and the egg thing, because I didn't start. I wore it so much because it was thinning, not the other way around.
Yeah.
So would you put that in the old wives' tale category? I've usually characterized it that way. You said yeah.
All right. Interestingly, as long as you're going down that road, this actually will grow hair wherever you need hair, right? The belief that that's what this product does, or what this procedure does.
Well, the point is it can grow hair where you lost hair. But one of the things, the way this works, basically this is like a messaging model. All cells produce these extracellular vesicles, and these come from stem cells, and so it reprograms those cells to help restore hair growth. Now, since they produce hair vesicles, the cells producing these other vesicles, it becomes like a kid playing, telephone as a kid. And so you can see hair growth outside of the area where you did the injection because of the sort of the local effect we think is the local effect of those changed cells producing new exosomes that are extracellular vesicles that talk to the other cells and can stimulate hair growth even in places we hadn't done injections.
So you've done injections. This is for men or women, by the way. And in some cases you've done injections.
This is for both. A lot of women have issues where they've overplucked their eyebrows, and the eyebrows thin, or thinning hair with a part. So it's helpful for both men and women.
So men and women on the scalp, but also in some cases women. You mentioned the eyebrows, and they will regrow the eyebrow line.
Women have. It's harder for women too that have hair issues falling out. I think it becomes socially more difficult for women.
Yes.
Yeah.
This is a lot of women maybe treating just the area of the part because they're seeing too much scalp, and so you're trying to bring back a little bit of that youthful look.
Yeah.
So Doc, I think I'm about 2.5 weeks since I saw you. Like I said, initially I was like 2 days in. I'm like, I feel like it's thicker already. And a friend of ours, Doc, that you and I know, said, "Oh, stop it! It's been 2 days. What are you talking about?" So let me ask you this. It typically takes 6 to 12 weeks. Could I be seeing something already, or is that in my mind?
No, you can. That's why we take so many pictures, because you can be seeing things, but at a certain point, how much are you seeing something because it's really there, and how much you're seeing something there because you want it to be there.
Right.
But in patients where the hair is thin, you can see changes because the hair follicle that's already producing the hair, it can be stimulated so that the hair itself is becoming thicker. You may not have increased numbers yet, but that the individual hair has gotten to be a bigger diameter from like a 2x4 to a 2x6 if this is lumber.
Right.
Okay. All right. Well, that's very interesting. And so what do? You make a phone call, set up an appointment, you do a consultation. How's the process work?
You give us a call. We'll talk with you. We go over exactly what this can and can't do for you. Sort of look to try and meet you, help define your expectations. What are the chances that this will do the job for you? There's what we know and what we don't know, and see if it's a fit for you.
And one more thing, Doc. What would you do to somebody who says the doc mentioned it's not FDA approved? They might have a concern about that.
Well, there are lots of things that are not FDA approved that are in common use. For example, the clot-busting drugs that they used for reversing heart attacks was being used in what's called an off-label manner for about 10 years before it was approved. In plastic surgery, we were doing liposuction for about 15 years before you had instruments that were officially approved for liposuction. So, there are medications we use for chronic pain, like gabapentin, that are not approved by the FDA for pain. Their approval is for seizures.
Okay.
This is where it becomes the issue of the practice of medicine. That the doctor understands, what this can do for a patient, what the risks are, and the same issue is even like with the COVID vaccines right now. You have the trials that have shown that it's efficacious, but it hasn't really completed the full FDA approval process yet.
There's also interestingly, a medicine right now that's being used for pre-diabetes that has an interesting side effect, and that is people tend to lose weight. And so now they're being prescribed this in order to lose weight, but the FDA doesn't approve that as
for that purpose.
You got to wait for that to come around. I believe that would be similar, right?
A similar type thing, and this is where there's some things. I mean, that things are discovered by accident.
Yeah.
For example, do you know the story of Viagra?
I don't, but it's going through my mind right now. I can only imagine.
Well, what the story was, Viagra was originally conceived as a drug for high blood pressure. And so there was a study being done, and it didn't work very well for controlling high blood pressure. So when they terminated the study, they were calling for the drug back from the people who were participating in the study. Well, some enterprising person at the drug company realized that they were getting the drug back from the women, but not from the men.
I'm not returning these pills. You gave them to me.
It says a lot about the marriage if the women are trying to return it for the guys.
Well, I didn't get that far into the explanation, but basically that's how that got started.
That is very interesting.
Just quickly, a couple other things. This is considered cosmetic, so it wouldn't be covered by insurance, correct?
That's correct.
Then you offer a number of other cosmetic procedures, and I'll let you mention them if you'd like, but I also want you to include the Dolly Parton line, and why I think it's important is because the doc is in favor of an approach that is a subtle change. As he had said to me, it's one of those things where someone looks at you and notices you might look a little different.
Right.
They can't put their finger on exactly what it is. Can you talk about that? The other services you offer, and I love the Dolly Parton line.
Well, we do a lot of different things. We want things to be very, very natural. We want you to recognize yourself in the mirror. And that's where the same injection we use for the hair we use in the face, where it helps to reanimate and make the face more youthful. Where we've had a number of people where the spouse is like, I wasn't sure about you doing this, but I'm glad you did, because you look better, but you don't look different.
Right.
And this is where I don't like Dolly Parton has made the comment. It costs a lot of money to look this cheap. And the problem is that she has done so much where she's been pulled enough that her mouth is starting to look more like the Joker than what she looked like 20, 30 years ago.
That is really true.
Case in point, look at Joan Rivers. Rest in peace.
Joan Rivers, Kenny Rogers.
Kenny Rogers was, he had just one. His face was completely still. No matter what happened, he could be in a hurricane, and there was nothing going on there.
You never knew if he was going to hold him or fold him.
Suzanne Summers looks pretty. Suzanne Summers looks pretty darn good for a grandmother. It's unbelievable, and I'm not sure how much she's done, but it's interesting. All right, great point there. I have Joe with a question. Joe, you're on with Dr. Denis Branson. What's your question?
Yes, Doc. I'd like to know how much it is per injection for the hair restoration.
Well, it depends upon how much we use. It can range anywhere from about $1,800 to $9,000.
Wow! So it's something that if you use it often or you use a lot,
it's more a matter of using a lot.
Okay,
how much we're using over how wide an area.
Wow. Okay. All right. Okay, Joe, thanks.
In comparison, Doc, I mean, people have seen me, people who are on the television, even people you can check me out on the website. I had a thinning situation really down the middle here. I'm sure they could still see it on television now this morning. Where do I fall into that range? That would be obviously on the lighter end, right?
You'd be in the mid range.
Yeah. Okay.
Now, and again, this is where one of the questions with this is that the work we've done with this in terms of dosing, we're still working out what is the most appropriate dose, and different people can respond differently. And so, basically, for someone that we're cost is a bigger consideration, or budget is a consideration. You may not treat the entire area. You may treat a more selected area that's more intense. To get your toe in the water. And if it's doing very well for you, you can always do more.
All right, very interesting. The phone number is 315-446-8313. drbranson.com is the website, located in Fayetteville. Dr. Denis Branson, thanks for coming on. We appreciate it.
My pleasure. Good talking to you this morning.
All right, have a great day.
Thanks, Doc.
Thanks.
Have a great day. Bye-bye.
By the way, for me, it would be like, in terms of cost, it'd be like, okay, do you want to live out in the woods or have a home?
Yeah, we're going to sell the house. We're putting it up on the market.
Yeah, I think I've gone a little too far myself. But it is interesting, and it's early stages, so you can only imagine that it'll become more prevalent and more common as time goes on, especially if you start to see success. And the beauty of this is, here's what I say. I have more confidence in this because it's not inexpensive. If you get if it's $1,800 versus, you could spend up to $10,000, I guess. So it's not inexpensive. And this doctor is willing to try it on you, knowing you're on TV every day, knowing people are going to look at the before and after.
Right.
I would say
you'll be able to see if it's working.
It's
or
unlike
if it's not
other.
working.
This is not, and I'm comparing it to other programs that I've had. Like I had this one woman come on 20 years ago, and it was a thing. It was a massage thing, and their goal, because this was like $99. Their goal was to sell as many as they could in that short period of time, and hope that people didn't pay attention to the fact that it wasn't growing hair on people.
Right.
This is different. This is a decision you'd have to make. And you're going to make, my guess is many people will make the decision based on the success that you have. And that tells me that this doctor believes in this and is really standing behind it.
Also, I think it is, like you said, it can be a little pricey, but there's a reflection of that it is a successful treatment. Secondly, it's significantly less expensive than
if you do the hair transplant thing and the pain you go through with that. I know somebody that had that done. They literally take the hair, the skin, and everything right off, stretch the skin back down, and then place the skin from the lower neck there.
I don't think
on the head. Holy cow! I don't want my hair that much.
I couldn't go through that.
Yeah,
I couldn't. I don't think I could. That's just me personally. With again, that to me that is kind of invasive. And you have the scar in the back of the head, but I'm not. Again,
you're going to want to wear a mullet for the rest of your life to cover that scar. It's just terrible.
When I learned this was available and it wasn't a surgery and everything we just talked about, I'm like, you know what? I'm absolutely willing to try this.
All right, pretty cool. All right, we'll be watching with a keen eye